It's a constant fear for Richard Martinez that the anti-retroviral drugs he needs every month will not be available. HIV-positive Martinez has been living with the disease for nearly 3 decades. But his health has declined in recent years because the drugs he needs, which are distributed by the government, are regularly in short supply.
From 2016 onwards, or 3 years ago, the shortages became more frequent and extensive. It's become the shortages of shortages. Lately, I'd say in the past couple of years, the situation has become distressing and absolutely chaotic.
An HIV/AIDS specialist, Mario Kamenga, says around 120,000 people in Venezuela are HIV positive. That's a little less than 1% of the population, and the country's humanitarian crisis has hit them particularly hard. Even if there are no official numbers, there's been a marked increase in AIDS-related deaths.
It is difficult to get accurate data because there is still discrimination. The reports of patients who die of AIDS-related illnesses often don't mention they were positive. So the data is scarce, but it is clear that an irregular supply of medicine increases the mortality rate.
There is a flicker of hope, though. The Pan American Health Organization and UNAIDS have sent money and medicine to the Venezuelan government. But distribution is still unreliable. Many of those affected say they prefer to stay quiet out of fear of discrimination.
Sometimes protests are made up of just 4 people. There's often no one, or because there's no one to protect us. People are afraid to go out and protest because of the stigma. That is also why we are dying, because of the image and the fear of losing our jobs.
Knowing their lives could depend on it, more than 10,000 HIV-positive Venezuelans have already left the country. Richard, though, has vowed to stay and fight to get his medication, as well as to combat the still many stigmas in Venezuela around HIV and AIDS.
Well, finally,